Imagine opening your eyes. You're lying on the ground, concerned faces all around you. Your friends, family, maybe even paramedics. They tell you you've just woken up from having an epileptic seizure, and you can hardly believe it because you don't remember the past 2 hours or so. How would you handle this situation, or how would you handle being one of the surrounding people? A short while ago, I was diagnosed with epilepsy. My neurologist informed me that stress, lack of sleep, and alcohol are main contributing factors to having an epileptic seizure. Those three things sound pretty familiar, right? In a nutshell, they describe the day-to-day life of a college student. Epilepsy is an overall broad term. It's characterized as a brain disorder that causes periodic seizures and convulsions. However, the type of seizure can vary from person to person. Although many different things can trigger an epileptic seizure, the top three things are identified as stress, lack of sleep, and alcohol. When a seizure is occurring, there's nothing you can do to stop it. However, it is important to be aware of how long it lasts, the steps to take once the seizure has ceased and the person is regaining consciousness. The first thing I'm going to talk about is the broad disorder of epilepsy. The Epilepsy Foundation defines epilepsy as a disorder that produces seizures that affect a variety of mental and physical functions. A seizure occurs when nerve cells in the brain unusually fire. For a short duration, this can alter a person's consciousness, movements, and actions. A seizure can last from seconds to minutes and have various symptoms. Some are unrecognizable to the person and even healthcare professionals. The two most general recognizable types of seizures that occur in epileptics are described as grand mal and petit mal seizures. A grand mal seizure is exactly what you would expect to see when you're thinking of someone having a seizure. The person will lose consciousness, their muscles will stiffen, and they'll begin to shake and convulse. A petit mal seizure is less commonly known and recognized because throughout the course of the seizure, the person might not even know that they're having it. They're completely awake, and they only last a couple seconds and have no warning or after effects. During the petit mal seizure, the person has a lapse in awareness and is most often accompanied with staring off into space. Statistics collected from the Epilepsy Foundation show that about 1 in 26 people will develop epilepsy in their life. This puts epilepsy on the map as the fourth common neurological disorder in the country. The good thing is that epilepsy can eventually go away. Now that you know what epilepsy is, I'm going to talk about some of the triggers. According to the book Epilepsy 199 Answers, the direct factors that provoke a seizure are unpredictable. However, we are aware of many causes that contribute to the triggering of a seizure. The most common causes attributed to having a seizure is mismedication. However, I'll be focusing on three other main factors for the purpose of audience relation. One of the leading causes, according to the Epilepsy Foundation, is excessive use of alcohol. It is also known that fatigue and loss of sleep is another main cause for concern. Some studies also indicate emotional stress, anxiety, worry, and anger, especially coupled with the other two factors I just talked about. Stress creates a favorable condition for a seizure to occur. It is important to recognize the triggers because although epilepsy is most common in young children and elderly, it can onset on any age. I found out I was epileptic when I was 20 years old, and I had a series of seizures which all occurred in periods of heightened stress. Now that you know some of the triggers, I'm going to let you know what to do in the event of someone having a seizure. In the book, Epilepsy, A Guide to Balancing Your Life, we are informed that most seizures in general are over in a short amount of time, so there's only a little period of time to do something if that's even possible. There are certain measures you can take to prevent the person from becoming injured during the seizure. As mentioned earlier, there are different kinds of seizures, the most violent being a grand mal seizure. Although there's nothing you can do to stop it, there is some things you can do to prevent injury to the person. The person will have no control over their movements or actions, and so it's important to lay them on their side and move any items in close proximity that could potentially harm them, such as scissors or objects with sharp edges. Along with that, make sure to loosen anything around their neck that may cause choking or constrict them, such as a necktie or a necklace. Most importantly, time the seizure. If the person is a known epileptic, there will be no need to call an ambulance or 911. However, if it's approaching 5 minutes or lasts longer than that, it's considered a medical emergency, in which case the calling 911 would be necessary. There are many common misconceptions that some people may think are necessary when witnessing a seizure. The most common is putting something in the seizing person's mouth. Despite what you may think or what you may have heard, it's not possible to swallow your own tongue and choke. A person may bite their tongue during the seizure, but that's only a minor thing. so no object should be placed in the mouth to prevent this. Epilepsy is a common neurological disorder in the United States. It is important to be informed about what it exactly is, the common causes of a seizure, and what you can do to help a person in the midst of one. Being epileptic is described as having 2 or more unprovoked seizures. However, 1 in 10 people will have a seizure in their lifetime, epileptic or not. Being informed on the processes of a seizure disorder does not only benefit those who have had it, but also the 1 in 10 who will experience it.